Hello and welcome to another episode of Let's Talk Health. Today's session will be on ear infection, and to discuss this we have with us Dr. Ravi Charan, Senior Consultant ENT Head and Neck Surgeon at Citizens Hospital, Shellingampally, Hyderabad. Good evening, sir.
Good evening.
So before we start with the questions, I request you to give our viewers a glimpse of your expertise.
Hello, I'm Dr. Ravicharan Palwai. I'm ENT surgeon at Citizens Hospital, Nalagandla. My expertise is mainly in all the ear, nose, throat related diagnosis, treatment, and surgeries regarding all the three fields. So I have an experience of around 25 years in this field, and I have been working on all the issues for quite a long time.
So moving to our questions, sir. What are the common causes of ear infection and who is most susceptible of that?
The most common causes of ear infection are allergy, trauma. Third is barotrauma. This ear infections can be presented in anyone from a child to an elderly person. In children, the most common cause of ear infections are secondary to allergy or a common cold. When the child has an allergy or a common cold, this can block the eustachian tube between the nose and the ear, and the child can present with ear infection. So, the second thing is trauma. The trauma can be because of cleaning of the ears with an earbud or an injury to the ear. This trauma can present with pain and ear infections. The third is barotrauma, which is very common in divers and people who are not trained divers, but when they try to do deep sea diving, these people can present with pain and ear infections secondary to barotrauma.
The next question is, what are the typical symptoms of an ear infection and how can someone differentiate between an inner ear infection and outer ear infection?
The typical symptoms of any ear infection is pain and ear discharge, difficulty in hearing. These are the three presentations of any ear infections. The pain can be continuous or it can be intermittent. In children, usually it is intermittent. This pain comes mostly in midnight when the child is in deep sleep. The child gets up with pain and starts crying. So this is the type of presentation usually we see in children. In others, which is secondary to trauma, then it is a continuous pain, and this pain can become more when the patient is having food or when the patient is swallowing something or when the patient is opening up his mouth. In these conditions, the pain can increase in these patients. And we can see these infections sort of two types. One is which is caused in the external auditory canal, that is the external ear, and the second is in the middle ear, that we call it as secretory otitis media or ASOM. So how to differentiate between the infections of the external ear and the middle ear? These middle ear infections present always with difficulty in hearing, fullness of the ear, and pain. These are the three symptoms when the patient has a middle ear infections. These are the three symptoms with which the patient presents to the ENT clinic. In a otitis externa, that is the external ear, the pain is always continuous, and this pain increases when a patient swallows food or when he tries to chew or when we try to press over the pinna or tragus. This patient will have increased pain.
The next question is, sir, are there any preventive measures or habits that can help reduce that risk of developing ear infection?
Yes, definitely. If you don't get repeated episodes of allergy and you don't cause trauma to your ear, these infections can be prevented. In children, it's better not to give any cold items, and you have to keep the child warm when you are going out, and don't give child any food item he is allergic to. All these things prevent allergy in the child, and this prevents infection in the child. And in adults, I would say that always, whenever you have an cold or an allergy, don't blow your nose. This will spread the infection from the nose to the ear, causing ear infections and ear discharge. And don't try to clean your ear regularly. The ear shouldn't be cleaned on a regular basis with an ear tip or anything, or any sharp objects. This causes trauma to the skin, causing infection and ear pain.
Into the next question, sir. What are the potential complications that can arise from untreated or recurrent ear infections?
Yes, this we can divide it into two, the one in children and one in adults. In children, when there is an infection and you don't treat it, when the infection is acute, we call it as acute suppurative otitis media. As the time passes by, this can change into secretory otitis media. What is the difference between acute suppurative otitis media and secretory otitis media is ASOM is an acute infection in which there is collection of fluid behind the eardrum. But in secretory otitis media, these same secretions become thick like a gum, and this can cause retraction of the eardrum, and if it is still neglected, this can become an atelectatic drum where the eardrum is completely pulled inside and is plastered to the medial part of the middle ear. So these children can present with severe hard of hearing, and if it treated in the early stages, it is treatable completely. But if it is neglected, then they can have complications which cannot be treated by simple medication. And if you say go for the second thing in adults, when there is an infection, always it presents with a perforation, ear discharge, and with repeated infections, there can be a decreased hearing secondary to sensorineural loss, and these patients, once a sensorineural loss sets in, is for lifelong, and this is irreversible.
So the next question is, sir, are there any home remedies or over-the-counter treatments that can provide relief from the symptoms of an ear infection?
Yes, there is nothing like over-the-counter treatment for any ear infection, because any ear infection has to be first diagnosed and treated. So, but yes, a child crying in the midnight, or suddenly you are in some place like a barotrauma where suddenly you have an ear pain which is excruciating. These are the times when, yes, we can think about some on-counter medications or this thing. In children, if the child cries, then the first thing we ask the parents is just give the child a paracetamol or a combination of ibuprofen with paracetamol, so that the pain comes down and child sleeps, and the child can be taken to the doctor next day. In an adult, if there is an pain with ear discharge, I would say that don't go for on-counter medications. Always visit a doctor before taking medications. Yes, in a barotrauma, always it is secondary to raising, means going deep into the water and coming out suddenly. In those cases, just go down again and come up slowly. And in all the conditions, if you give some steam inhalation to the nose, it can give temporary relief and the pain can come down.
So the next question is, sir, can you provide information about antibiotic use for infection and when it is necessary?
Whenever there is an infection, there is an allergy, you don't need an antibiotic. When there is a child or an adult is suffering from allergy or a common cold, I would say that we don't need an antibiotic in those cases. But there is an infection and the patient is having pain with discharge or any of these conditions, then a antibiotic has to be given. But I would not recommend any of the patients to start antibiotics on their own, because for different conditions we have to give different types of antibiotics. So the patient, it's better that the patient comes to a doctor, get himself diagnosed, see what is the problem, and then only appropriate antibiotics are given.
So coming to the next question, sir. Are there any long-term effects or implications of frequent ear infections, especially in children?
Already I have spoken regarding that. So whenever a child has an infection, immediately the child has to be treated, it has to be taken to a doctor, and we have to just find out what is the cause of the ear infection, and if it is coming repeatedly, then we have to rule out adenoid hypertrophy, whether there is tonsillitis, which is a source of infection for the ear infections. And when it is in the acute stage, yes, with antibiotics it will get treated. But I would recommend the parents that any child with an ear infection, and if the child is not responding to your call after an ear infection, then he has to be properly investigated, and long-term complications of these ear infections have to be prevented.
So coming to my last question for the day, sir. Can you discuss the importance of proper ear hygiene and how to safely clean the ears to prevent infections?
See, actually, the external ear or middle ear has its own defense mechanisms where everything gets cleaned by itself. So I would recommend that it's better that you don't touch your ear as much as possible. But yes, wax is nothing but it's like sweat. They are modified sweat glands where the wax is produced daily, and in 90% of the patients it comes out on its own. But in few patients it starts getting collected inside. I would recommend that these patients once a month after a head bath use a ear tip and clean the ear only in the external part. Don't go deep into the ear, and clean your ear without touching the skin. That would be enough for cleaning the ear, and to keep, I would say that to keep it is further ear hygiene.
So thank you, doctor, for your valuable time and inputs. So with this, we conclude today's session of Let's Talk Health. We'll be back with another episode next week. Till then, take care and be safe. Thank you.
Right. Bye.